অনুষ্ঠানটি নিবেদন করছে অ্যাপোলো হসপিটাল, চেন্নাই।
নমস্কার, আপনারা দেখছেন অ্যাপোলো হসপিটাল চেন্নাই প্রেজেন্টস হ্যালো ডক্টর। শিশুদের হার্টের সমস্যা, এই সমস্যা কিন্তু বাড়ছে। কোনো সময় আমরা বুঝতে পারি, কখনো বুঝতে পারি না। দেখুন, বড়দের বুকে ব্যথা, বড়দের হার্টবিট বেড়ে যাওয়া, বড়দের বিভিন্ন রকম সমস্যা তারা মুখে বলতে পারে, কিন্তু নিউবর্ন বেবি থেকে 2 বছর 5 বছর তারা তো ঠিকমতো বলতে পারে না। সে কারণেই তাদের হার্টের কেয়ার আরও বেশি করে দরকার। তবে ভয় পাওয়ার কিছু নেই, আপনার পাশে আছে অ্যাপোলো চিলড্রেন হসপিটাল চেন্নাই, আছেন তাদের এক্সপার্টরা এবং পেডিয়াট্রিক কার্ডিওলজিস্টরা। আগামী এই অনুষ্ঠানে আমরা বেশ কিছুক্ষণ এই বিষয় নিয়ে আলোচনা করব। একজন শিশুর হার্টের সমস্যা হয়েছে কিনা কিভাবে বুঝবো, হলে কি করব, কি রিসেন্ট অ্যাডভান্সমেন্ট, কি উন্নত মানের চিকিৎসা রয়েছে। অ্যাপোলো চিলড্রেন হসপিটাল চেন্নাইয়ের তরফ থেকে আমাদের সঙ্গে রয়েছেন এই মুহূর্তে কনসালটেন্ট পেডিয়াট্রিক কার্ডিওলজিস্ট অ্যাপোলো চিলড্রেন হসপিটাল চেন্নাই থেকে ডক্টর রামকিশোর। Dr. Ramkishore, thank you for coming from Chennai and welcome Apollo Hospital Chennai presents Hello Doctor. Sir, firstly we want to know what are the most common heart disease condition you treat in pediatric patient?
Okay. Regarding pediatric patients, the common heart problems are hole in the heart. So the hole in the heart can be at various places, like in the upper chamber, in the lower chamber, or in the tubes which come out of the heart. Other than that, we have problems like valve obstruction, valve leak, and heart muscle problem. So we have different treatment for all these conditions, which are advanced and which are more benefiting and almost curable.
Sir, what you see in cases increase day by day, the child heart problem is increase.
The majority of heart problems which we see in children don't increase day by day. Actually, they are already present in our community. The current incidence of heart problem is estimated to be around 8 to 10 per 1,000 children who are born in India every day. So it's already present in our community. There are some diseases like rheumatic heart disease which involve the valves of the heart, which can actually be acquired by the child as the child grows. Rest of the diseases are present when the child is born.
Okay, sir. Another question is, could you walk us through the process and assessing a child for a suspected heart condition?
Okay, this is a good question. So when the parents have symptoms of heart problems in their child, so what are the symptoms? Like breathing difficulty, sweating, bluish discoloration of nails, fast breathing, fast heartbeat, or they have a family history of heart problem, that is when they have to be alerted and they have to bring the child to an expert doctor who treat heart conditions in children. That's called as a pediatric cardiologist. So when the parents bring the child to a pediatric cardiologist examines the child, takes important measurements like BP, oxygen level, and they do an echo scan in the child to diagnose the heart condition. Once the heart condition is diagnosed, the treatment will vary depending on the heart condition. So this is how we will evaluate a child with a suspected heart disease. There are advanced imaging modalities like MRI, CT scan, which can be done to further understand the disease better.
Sir, how do you manage the situation when you see a children need undergo surgery, and how can you manage the situation, manage the family condition?
I know it is a big decision for the child to make, because no parent would want a child to undergo an open heart surgery, opening the chest, getting a big scar, but it is essential to save the life of the child. So it is a condition which is present from birth. It has to be treated. Only then the child can lead a normal life, say go to college, have children, and lead a normal life. Even though it looks little tough journey, it is always essential. So we counsel the parents in such a way that it is a short term difficulty for the family, but the long term benefit the child will get is immense.
Sir, what do you see in treatment? What areas of pediatric cardiology do you believe any breakthrough or new treatment in the coming 5 to 10 years?
Yes. We do have a lot of conditions which were treated by surgery 5 to 10 years ago being done by angiographic method. Angiography means we put small wires through the child's veins in the thigh. we go to the heart and we treat the condition. So what was only surgery 5 years back has become transcatheter methods now. We have also advanced in such a way that we could do complex surgeries like Fontan in transcatheter way. Fontan is one procedure which has been done surgically for the past almost 30 to 40 years, but now for the last 2 to 3 years we are doing that method also in transcatheter way, which is an important breakthrough, and very few centers even in the world level are doing that, which we are doing in Chennai. We have done around 20 cases, we have been successful in that, and that I believe is the biggest breakthrough in pediatric cardiology in India.
Sir, undergo surgery and open heart surgery are both are same?
Yes, open heart, see there are two methods of treating heart diseases in children. Number one, it is surgery. So that has been there for a long time, and that has been the method of choice for almost 5 years back. But now technology has advanced. We have angiographic way of treating or transcatheter way of treating heart diseases, which involves AST closure, VST closure, PGA closure, heart valve implantation, and so many other methods. So that is what we have arrived today through advances in science. So surgery is not the only method of treating heart conditions. There are other methods also, which is very important for the parents to know.
Sir, what is recent advancement in pediatric cardiology are you so much excited about?
No, as I already said, the important advances which we are more excited is this transcatheter Fontan method, where we are actually doing a procedure which has always been surgery for many years now. Doing it in transcatheter way actually avoids a major surgery in children. Apart from that, we have valve implantation. We can replace all the 4 valves in the heart through this transcatheter method. I think that is a very significant improvement in pediatric cardiology. Apart from that, holes AST, VST, PDA can be easily closed by the transcatheter method. These are all exciting improvements in the field of pediatric cardiology.
অর্থাৎ আপনারা বুঝতেই পাচ্ছেন যে সব জায়গা থেকে অ্যাপোলো চিলড্রেন হসপিটাল চেন্নাই কেন আলাদা, কতখানি আলাদা, কি কি রিসেন্ট অ্যাডভান্সমেন্ট আপনারা পুরোটাই শুনলেন। আমি শুরুটাই যেভাবে করেছিলাম যে বাচ্চাদের মধ্যে, শুধুমাত্র বাচ্চাদের মধ্যে, শিশুদের মধ্যে বলাটা ভুল, একেবারে নিউ বর্ন বেবিদের মধ্যেও কিন্তু পেডিয়াট্রিক অর্থাৎ বা শিশুদের মধ্যে এই হার্টের সমস্যা, কার্ডিওলজি সমস্যা দেখা যাচ্ছে। এখন সমস্যা হলো বড়রা বলতে পারে, ছোটরা তো আমাদের বলতে পারে না সেভাবে, তাই তাদের বোঝাটা কিন্তু খুব দরকার। মা বাবাদের তাদের উপরে একটু খেয়াল রাখতে হবে। যে সাইন অ্যান্ড সিমটমসের কথা স্যার আগেই বললেন, সেই সাইন অ্যান্ড সিমটমস যদি সদ্যজাত নিউবর্ন বেবি হয়ে থাকে বা 2-3 বছরের বাচ্চার শিশুরও হয়ে থাকে, এগুলো কিন্তু আমাদের খেয়াল করতে হবে, কারণ তারা মুখে বলতে পারে না, এবং যতক্ষণে বলতে পারবে ততক্ষণ হয়তো অনেকটা দেরি হয়ে যাবে। কিন্তু এত কিছুর পরেও হতাশ হয়ে যাওয়ার, ভয় পাওয়ার বা চিন্তিত হওয়ার কোনো কারণ নেই। আরও একবার বলবো, অ্যাপোলো চিলড্রেন হসপিটাল ইন চেন্নাই রয়েছে, আপনাদের পাশে রয়েছেন এরকম এক্সপার্টরা, এরকম পেডিয়াট্রিক কার্ডিওলজিস্টরা। তাই এইরকম কোনো সাইন অ্যান্ড সিমটমস থাকলে কিন্তু আপনাদের পৌঁছতে হবে। এবার বলি কিভাবে যোগাযোগ করবেন, কিভাবে যাবেন, কিভাবে সাজেশন নেবেন, সমস্তটাই কিন্তু আমাদের স্ক্রিনে যে নাম্বার যাচ্ছে, 2টি নাম্বার যাচ্ছে আমাদের স্ক্রিনে। একদম চিন্তিত হবেন না, কোনো দ্বিধার জায়গায় নেই, কারণ বাংলাতে, হিন্দিতে, ইংলিশে আপনি যে ভাষায় কমফোর্টেবল সেই ভাষাতেই এই ফোন নাম্বার দুটিতে যে কোনো একটিতে ফোন করুন, আপনার সমস্যা জানান বা আপনার শিশুর যে সমস্যাগুলি হচ্ছে সেগুলো জানান, সেটাতে কোন ডিপার্টমেন্টে দেখাবেন, আদৌ সেটা কার্ডিওলজি প্রবলেম কিনা, এই সমস্ত কিছু গাইডলাইন কিন্তু আপনি পেয়ে যাবেন। তাই কোনো রকম সময় নষ্ট করবেন না, কারণ সময়টা খুব দরকার, খুব এই ট্রিটমেন্টে কিন্তু খুব গুরুত্বপূর্ণ ভূমিকা রাখে। আমাদের কি হয়, আমরা সময়টাই অনেক বেশি নষ্ট করে ফেলি। আমরা রিসেন্ট অ্যাডভান্সমেন্ট জেনেছি, এবার আমি একটু স্যারের কাছে জানবো যে জেনেটিক কাউন্সেলিং কি। স্যার, হোয়াট ইজ দ্য জেনেটিক কাউন্সেলিং when it needed to pediatric cardiology problem?
Okay, see, whenever a family encounters a child with heart disease, they have to be alert, because heart diseases in children are usually transmitted through genes which are present inside our body, which are transmitted from the mother and father to the children. So when there are defective genes which are running in the family, the heart disease can also come from the parents to the child. So whenever a family comes to me with a previous history of heart disease, I always assess what is the disease, what is the mode of inheritance, which means what is the chance that if they have a baby, the baby will have a heart disease. And the most important thing, if the percentage of having the heart disease for the baby is high, it is very important to do a fetal echo. Fetal echo is when the baby is inside the mother's womb. We get the echo done maybe by 18 to 20 weeks of pregnancy, and that echo is very important to diagnose heart disease in children, and if needed take further management steps to treat the heart disease. We can also be prepared to deliver the child in a higher or a tertiary care center for better management of the newborn child.
Sir, what you want to say, is it genetic problem in some cases?
Yes, majority of pediatric cardiology problems are genetic, that is they run through genes. There are diseases like rheumatic heart disease, valve problems, post-COVID myocarditis, post-viral myocarditis, dilated cardiomyopathy. All these do occur when the child grows, but majority of problems do run through genes.
Sir, we all know prevention better than cure. So, how much and how important is preventive care in childhood, in newborn baby, to raise the awareness and to reduce the problem?
Yeah, I think that is very important. So, prevention in pediatric cardiology, particularly for congenital heart diseases, is first of all the parents should be aware of any heart diseases which are running in family, and if it is there, as I mentioned earlier, get a fetal echo done. And genetic screening for mother and father is also very important. Now we have technology like whole exome sequencing which can assess the entire DNA of mother and father, find out if there are any possibilities of heart disease which can come to the child. So this is one way of assessing whether a baby who is born will have a heart disease or not. Apart from that, usual precautions during pregnancy like regular walking, weight reduction, not gaining too much weight, and treating diabetes early. So high sugar levels in mother can also cause heart diseases in children. Avoiding smoking, avoiding alcohol is very important for the antenatal mothers. And thyroid issues, if the mother has thyroid issues, that has to be treated very promptly. All these simple steps can prevent the child from having a heart disease, or at least assessing what is a heart disease in child and managing it very early so the child can lead a normal life.
Sir, why children are suffering from heart disease cardiology problem right now?
The majority reason for this is genetic, as I said earlier, but there are other diseases like poor socioeconomic status, that is unclean, like improper cleaning in houses, infection, high rate of infection, not wearing masks when they go outside, because it's very difficult for children to wear masks. That is the main reason they get lot of respiratory infection. And even the common viruses like flu viruses or other respiratory viruses can also affect the heart. So it is very important they maintain personal hygiene, and when they travel to places, it's important that they wear masks and protect themselves from respiratory infections. And always when there is a heart disease, the very important thing is treat early. Early treatment is the best cure that can be given to the child.
Sir, from long time you treated the cardiology problem in children, pediatric cardiologist, as pediatric cardiologist. What do you see, sir? It increase after COVID?
See, pediatric cardiology incidence has been remaining the same. It is around 8 to 10 per thousand. Post-COVID, we have seen diseases which are affecting the muscles of the heart. That is inflammation of the muscle of the heart, which is called as myocarditis, which can cause heart dysfunction or poor heart function. So that is something which we have seen increasing. There is also increased incidence of thrombosis, that is vessels getting clots. So all these conditions have increased post-COVID, but the rest of the incidence of heart diseases remains the same. It is not affected by COVID.
Sir, you told me rural areas children are more affected.
Correct.
So do you work with the communities, with the school to raise the awareness, to reduce the problem? Do you work?
Yes, we do. We go from Apollo Children's Hospital, Chennai, to various places, not only across Tamil Nadu, across various parts of India, Mizoram, Shillong, Bhopal, North India, and even other southern states, and we go to the schools, we go to the DEIC centers, we go to the PHCs, we do regular camps there, we do echo screening of suspected children. Say the local pediatricians might have children with suspected heart disease, we bring those children to those centers, assess them and find the diseases in them early, we bring them back to Chennai and we treat them. So this is how we can identify those diseases early in life and treat those children.
Sir, how do you see the pediatric cardiology sector evolving in the year of 5 to 10 years, next 5 to 10 years?
Yes, pediatric cardiology is going to become one of the biggest fields of cardiology or the subfields of cardiology in the next 5 to 10 years. Definitely, the way we are going forward, we can treat many conditions in the transcatheter way, that is without any scar, without any like ICU stay. Just for a day the child has to stay in hospital. Within 20 to 30 minutes we complete the procedure. That is an important breakthrough in pediatric cardiology, treating the diseases without surgery, without any scar, without any ICU stay. That will happen more in the next 5 to 10 years.
Sir, you have long time experience. So, what are you see there are any significant challenges, any critical condition are there in treatment of pediatric cardiology?
So, we can assess this question in two ways. So, one is from the financial point of view.
Yes.
I think these transcatheter methods are costly. We have to buy lot of hardwares. We need sophisticated cath lab machines to treat these conditions. Of course, our governments are supporting us in many ways to treat these conditions. So, financial aspect or the financial difficulties are always there, but that can always be dealt with. When you approach us, we can always help it out, how we can do it, what is the best we can do for the child. So, that is one of the important difficulties we do face while treating these children. Regarding the conditions per se, there are many heart conditions which don't have a cure, but definitely we can support the child in the best way that the child leads a pain-free normal life. They can go to college, they can get married, they can even have children. So, we can support them. We may not be able to cure the disease, but definitely we can help them lead a good normal life.
Sir, then we want to know why patient party choose Apollo Children Hospital in Chennai?
Yeah. So, Apollo Children's Hospital has been a pioneer in treating pediatric cardiac conditions for many years. So, they have the advanced cath lab, we have the advanced hardwares, we treat children from 400 to 500 grams, that is very small babies, preterm babies, up to 90 years old adult. So, we have hardwares to treat such a wide spectrum of ages. We have skilled pediatric cardiologists, we have cath lab technicians, we have echocardiographic technicians, we have advanced imaging like MRI, CT, 3D printing, everything inside a single center. So, when you bring a child with any heart disease to Apollo Children, we have technology to assess the child, treat the child, and make the child a better person when the child exits Apollo Children's Hospital.
Firstly, needed genetic counseling.
Genetic counseling is not the first thing. First thing is, it is important for the parents to understand the disease and prevent disease when in the further children, when they want to have more children. So, it is more important that you treat the child which has been affected before giving genetic counseling to the parents.
Sir, every pediatric cardiology problem disease needed treatment.
Yes, of course. If it is not causing any problems to the heart, say if there is a very small hole or if there is a very tiny multiple holes which doesn't cause any stress or problems in the heart, we can always observe. It's not that every pediatric cardiology problem has to be treated, but that is little technical expertise which you have to approach a pediatric cardiologist. They have to do the echo, assess the condition, then watchful waiting is always an option which is available in pediatric cardiology problems.
Okay. Sir, we know all about the recent advancement in Apollo Hospital, Children's Hospital in Chennai. But what is your success rate last 10 years, last 15 years?
Success rate has been very good. See, transcatheter methods, as I told, the success rate varies, depends on the condition which the child has. Say simple hole in the heart like AST, VST, PDA, we have almost 100% success rate. Complex conditions which like valve problems, valve treatment, also we have a good success rate of 90 to 95%. So, success rate with the current technology is actually very good, and the treatment is very simple and the recovery is very fast for the child.
Sir, which type of pediatric cardiology problem is curable by the medicine, not needed surgery?
Okay. Medicine wise, it's very few conditions. As I said earlier, like we have post-COVID myocarditis, that is post-COVID heart failure, post-viral myocarditis, which are very mild. They can be treated with medicines. and some minor leaks, small holes in the heart, we can always treat with medicines. Do serial echo, say once in 6 months or 1 year, and observe the child. Sometimes they get cured with medicines, but majority of condition might need some intervention and might need observation under a skilled expertise.
Sir, once again, what are the primary signs and symptoms of pediatric cardiology problem?
Okay, the primary sign and symptoms is number one, fast breathing, excessive sweating all over the body, difficulty in feeding. The child might take some feed, rest, and then feed again, take rest, feed again. So it may not be a normal feeding practice which the mother might observe. Failure to gain weight, recurrent infection. The child might have been admitted multiple times with infections in the lungs and taken many IV medicines. Such children, and bluish discoloration of nails, lips, eyes, all that. These are the common symptoms which these children have, which should make the doctor or the parent suspect heart diseases.
Sir, fast breathing, what do you want to say? Not like normal.
Yes, not like normal. So they usually, child, say a newborn baby will breathe at 30 breaths per minute. Suppose it breathes at 60 to 100 breaths per minute. There is the chest indrawing is more significant. Such children, we should always think there might be, there can be lung problems also, but we should always rule out a heart problem before we think it is a lung problem.
Sir, what to do parents do the reduce the heart problem in their children?
It is not possible to reduce. As I said, it is a genetic problem mostly when newborn kids have these heart problems.
Okay,
so
we want to know preventive care.
Preventive care, as I said, maintain a clean environment. Avoid infections in children as much as possible. When you take your child outside, say to a function, if it is a bigger kid, encourage the kid to wear mask. Okay, when someone coughs near or when someone with infection comes near, ask them to move away or cover their nose and mouth as much as possible. Drink safe and clean water. Eat proper hygienic foods. These are simple things which can actually help the child to prevent infections like streptococcal infection, which are the main culprits in causing rheumatic heart disease. So preventable diseases can always be prevented by better socioeconomic environment, but genetic diseases, it's always early identification. That is the best way to move forward.
Sir, lastly, what do you want to say to pregnant lady, pregnant mother?
Yes. So whenever mother becomes or when a woman becomes pregnant, the first thing is they have to undergo a thorough checkup. So whether they have high sugar levels, whether their thyroid levels are normal, and whether they have any pre-existing problems like seizures or any other problems for which they have to take medicines continuously during their pregnancy, because some drugs can also cause heart diseases. The major important thing is avoid smoking and alcohol during pregnancy, during the entire time of pregnancy, particularly in the first 3 months, which is very vital when the heart forms and grows, first 3 months of pregnancy. So during that time, any amount of exposure to pollution, smoking, alcohol, radiation, all this can cause significant heart problems in the child. So the best way is take their medicines like iron and folic acid properly, get proper checkup with doctors, do the fetal scans properly, and when there is a suspicion of heart disease, always get a fetal echo early by 18 to 20 weeks of pregnancy.
Okay. তাহলে শুনলেন তো, সবটাই ডাক্তারবাবুদের হাতে ছেড়ে দিলে হবে না, সবটাই ভগবানের হাতে ছেড়ে দিলে হবে না। আমাদের হাতেও কিন্তু অনেক কিছু রয়েছে। আমরা সতর্ক থাকতে পারি, সচেতন থাকতে পারি, অনেক আগে প্রিভেনশন বেটার দ্যান কিওর। এই কথাটা তো আমরা ছোট থেকে শুনে বড় হয়েছি, অন্তত চিকিৎসা ক্ষেত্রে এই প্রবাদটা ফেমাস। আর এর পরেও, এই এত কিছু প্রিভেনশনের পরেও যদি কোনো ক্ষেত্রে সেটা হয়েও থাকে, তাহলে অ্যাপোলো চিলড্রেন হসপিটাল ইন চেন্নাই রয়েছেন স্যারদের মতো এক্সপার্টসরা। তাই এই সমস্ত সাইন অ্যান্ড সিমটমস যেগুলো স্যার বলে দিলেন, প্রিভেনশনের পরেও যদি কোনো সমস্যা হয়ে থাকে তাহলে কিন্তু আপনাকে যোগাযোগ করতে হবে। আমাদের স্ক্রিনে নাম্বার যাচ্ছে, যে ভাষায় আপনি কমফোর্টেবল, যে ভাষায় আপনি কথা বলতে পারেন, বাংলা, হিন্দি, ইংলিশ, অবশ্যই ফোন করুন। কোনো সমস্যায় পড়লে, আপনার শিশুর কোনো সমস্যা হলে, হার্ট রিলেটেড কোনো সমস্যা শুধু নয়, যে কোনো সমস্যায় কিন্তু ফোন করতে পারেন, কারণ অ্যাপোলো চিলড্রেন হসপিটাল ইন চেন্নাই অল ওভার দ্য ইন্ডিয়ার বেস্ট, যেটা শিশু বিশেষজ্ঞরা অত্যন্ত ভালো কেয়ারের সঙ্গে ট্রিটমেন্ট করে থাকেন। তাহলে আজ এ পর্যন্ত স্যার, ওয়ান্স অ্যাগেন থ্যাংক ইউ ফর কামিং ফ্রম চেন্নাই অ্যান্ড ডেসক্রাইব দ্য অল থিংস।
থ্যাংক ইউ।
আপনারাও খুব ভালো থাকুন, সুস্থ থাকুন, সচেতন থাকুন, দেখতে থাকুন আর প্লাস নিউজ, সবার আগে সবার পাশে।